John here from Anatomy Bootcamp, and welcome into another video. In this lesson, we're going to be talking about the ventricular system, which is those large empty spaces found deep within the brain. We're going to be talking about how they're connected, what they do, and what happens when they malfunction. So again, we're going to start off with a case study. In this case, we have a 33-year-old patient who's complaining of a persistent headache and feeling very lethargic. After examination, you determine that he has a loss of coordination as well as impaired vision. He has also been complaining of experiencing difficulties concentrating, thinking, and remembering things, which have all been affecting his performance at work. You order an MRI, and this is what you find. So here's our MRI scan right here. Clearly, something is going wrong. So by the end of this lesson, we're going to be discussing what happened here and how it's causing all of these symptoms. So first off, we're just going to start off with an overview of how the ventricular system is laid out within the cerebral cortex. So again, these ventricles, these are these large empty spaces, and they're going to be found deep within the brain. So you can see on either side, we have these large C-shaped structures with a little tail. Then towards the middle, we have these flatter kind of structures, and they're all connected. So these large ones on the outside, these are two lateral ventricles, and these lateral ventricles extend into the frontal lobe, the parietal lobe, the occipital lobe, and then they wrap around and extend into that temporal lobe. And these lateral ventricles communicate with this sheet-like ventricle in the middle, which also communicates and carries fluid down here into this fourth ventricle, and then it leaves that ventricular system and it submerges the brain in fluid to add an extra layer of protection. Now we're going to talk about the individual ventricles and break them down into their components and features. So starting off, we're going to be talking about the anterior horn of the lateral ventricle, and this is going to be extending into that frontal lobe. And that's why these are sometimes called the frontal horn of the lateral ventricle, because it extends into that frontal lobe. Our next region is the body of the ventricle, and that's going to be found right here. And that's going to make up the majority of that lateral ventricle that passes through that parietal lobe. Coming back to the posterior aspect of the brain, we're going to have our posterior horn, which extends into the occipital lobe. So you can refer to this as the posterior horn or the occipital horn of the lateral ventricle. And then finally, in our temporal lobe, we're going to have this region right here, and this is going to be the inferior horn or the temporal horn of the lateral ventricle. And the body, the posterior horn, and the inferior horn of the lateral ventricle, well, these are all connected at this region right here. This is known as the trigone, or the atrium, as it's sometimes referred to, because this is the region where we have the union of all the three horns coming together, and it forms a large sort of atrium or pocket in that space. So we have the anterior horn in our frontal lobe, our body in our parietal lobe, our posterior horn, that's in the occipital lobe, our inferior horn in our temporal lobe, and then our trigone or our atrium found connecting those horns. So now moving out of those lateral ventricles and moving into our midline ventricle right here, the way we gain access to this space is through these little openings, and these are known as the interventricular foramen. And these interventricular foramen are the only way that fluid found in the lateral ventricle can move down into this midline ventricle right here. And taking a step back and looking at our lateral ventricles again on this MRI scan right here. So you can see these two very bright hyper intense regions. Well, these are going to be our lateral ventricles. And then we have this structure, this thin sheet right in the middle. This is known as the septum pellucidum. And the septum pellucidum is a very thin sheet of tissue which separates our two lateral ventricles. And if you look at the name septum, because it's like a septum separating the two ventricles, and lucidum, because it's so thin that it's transparent. Well, it's almost transparent. It's almost lucid, so you could see through it. So this is that septum lucidum found between our two lateral ventricles. Now let's move into this ventricular space right here. So this right here, this is that third ventricle. And that third ventricle is that thin space found between the two lateral ventricles. And if you remember, this is actually where our diencephalon is located. So on either side of this third ventricle right here, this is where we're going to have those two thalamic bodies. So you'd have a thalamus on either side. If you remember what connects those two thalamic bodies, well, that's that interthalamic adhesion. And this opening right here, this is where that interthalamic adhesion passes through that space to connect those two thalamic bodies. And as you can see, we have some features of the third ventricle, like the supraoptic recess. So of course right here, this is where we're going to have the optic chiasm. We also have the infundibular recess right here. This is where that infundibulum is going to hang off, carrying that pituitary gland. And then back here, we have that pineal recess. This is where we're going to have that pineal gland. And then coming down, we're going to have a passageway or a tunnel, which is going to connect our third ventricle right here to our fourth ventricle right here. And this tunnel, or this canal right here, is known as the cerebral aqueduct. And this cerebral aqueduct, this is the only passageway between the lateral ventricles and the third ventricle to drain all of its fluid out into the fourth ventricle, but then into the subarachnoid space surrounding it. So a little side note, there's a condition known as hydrocephalus, and that is when fluid accumulates inside of the ventricular system. And that can be caused by a blockage right here in our interventricular foramen or in our cerebral aqueduct. If it's caused in our interventricular foramen, well, then you're going to see an asymmetrical swelling of the ventricle. So let's say it was on this side. Our ventricle would swell up on one side and compress the tissue against that cranial vault. If we have a blockage or occlusion in the cerebral aqueduct, well, all the fluid that's being produced in our lateral ventricles and our third ventricle, it can't leave. So the third ventricle is going to expand, as well as both of our lateral ventricles. Those are going to blow up as well. And that's going to increase the pressure dramatically within the intracranial space. But we're going to talk more on that in just a little bit. So moving back and looking at the fourth ventricle, the fourth ventricle is going to be found right here. And if you remember, the fourth ventricle is actually going to be sandwiched between our cerebellum and our brainstem right here. And then finally, fluid leaves the ventricular system and enters that subarachnoid space via our median and lateral apertures. So we're going to have one median aperture. This is going to be on the midline, and this is right down here. Then we're going to have two lateral apertures, and these two lateral apertures are going to be found coming out on either side of the brainstem. So now we're going to take a look at where fluid goes after it leaves these apertures. So once the fluid leaves through those apertures, the median and lateral apertures, it's going to enter into that subarachnoid space, which is going to be surrounding the central nervous system. And we're going to have some enlargements found around the space. And we're going to talk about this in just a second. But while we're on this MRI, let's take a look at some of the ventricles. So let's landmark ourselves. So of course, my go-to, that corpus callosum, use it every time. This is a good indication because right below that, that's where I know my lateral ventricle is going to be. Now this is actually the septum pellucidum. See, it's a little transparent. The ventricle actually extends something like that, and it comes down as well. So this septum pellucidum, it's almost like the window looking into that lateral ventricle. But you can see just under here, this is actually my thalamus. So I know this is going to be that third ventricle. You can see this little faint opening right here. This is actually the interventricular foramen. So fluid from the lateral ventricle is going to pass the interventricular foramen into this third ventricle right here. And then if you remember, how does it get from the third ventricle to the fourth ventricle right here? Well, there's a little bridge. You probably can't really see it here, but this is the cerebral aqueduct where it would be found. And if you remember from our brainstem lecture, this is that tectal area where we have our superior and inferior colliculi. Just anterior, that's where we're going to have that cerebral aqueduct connecting the third ventricle to the fourth ventricle. And then here we would have our lateral apertures coming out on either side, just inferior to the pons. And then we would have our median aperture coming out below, just anterior to the cerebellar tonsil. And when it leaves the median aperture, it's going to drain into this pouch right here. And this pouch, well, this is known as that cisterna magna. And so this is going to be found just inferior to our cerebellum right here. We have another space which is found superior to our cerebellum, and that's going to be this space right here. If you remember, another name for our superior and inferior colliculi are the corpora quadrigemina. So this is known as the quadrigeminal cistern, or simply the superior cistern. So when we want to find it, just remember superior to the cerebellum, and it's going to be just posterior to our superior and inferior colliculi. It's just this little space right here. Now moving anterior to the brainstem, we're going to have another cistern. It's going to be the interpeduncular cistern. And based on that name, you could probably guess where it's found. So it's going to be just anterior to our midbrain region. If you remember, on the most anterior aspect of that midbrain, we have those two cerebral peduncles, those two big structures carrying white matter tracts. So those cerebral peduncles are found on either side of the midbrain, and in the middle, there's a little groove or a fossa, that interpeduncular fossa. So that interpeduncular cistern is going to be the space just anterior to that interpeduncular fossa. And so the best way to find it, always look for the midbrain. Pons is a good indication of where the midbrain will be in relation to the rest of the brainstem, and it's just going to be that space just anterior to that. So then finally, all these cisterns, all these spaces, they're connected through the subarachnoid space. And I'll do my best to highlight it, but that subarachnoid space is just going to be that continuation all throughout the brain surrounding that central nervous system. It's that very thin space below the arachnoid matter, so subarachnoid, and this contains that cerebral spinal fluid which helps to protect and bathe that outside environment of the central nervous system. So now let's take a look at what is the actual function of these ventricles and how fluid flows through them. So the ventricular system is responsible for producing and moving cerebral spinal fluid, or CSF. And so the CSF is produced in the lateral ventricles as well as in the third ventricle and in some other areas, but mainly in these two. And it's produced by this structure right here. This is known as the choroid plexus. And we're going to start in the lateral ventricles. So the fluid is going to be produced and it's going to fill the lateral ventricle. Once the lateral ventricle is filled, it's then going to move through this interventricular foramen down into our third ventricle, where more CSF is also being produced. And so if you remember, if we had a blockage right here, we're not going to be able to transport that CSF from the lateral into the third ventricle. And then from the third ventricle, fluid is transported via that cerebral aqueduct into that fourth ventricle, and if we had a blockage here, we would not be able to transport fluid down into that fourth ventricle. And then from that fourth ventricle, again, it leaves through the lateral in the median aperture, filling our cisterns, filling the subarachnoid space, and bathing that CNS in the surrounding environment, and adding that extra layer of protection. And you can see as the cerebral spinal fluid has made its way, it's going to collect all the waste from the neurons surrounding it. It's going to take that waste, it's going to enter through these arachnoid granulations, which will then drain that fluid into our venous system and then return it to the circulatory system to allow it to be filtered and replenished. So now, coming back to our patient with that interesting MRI scan right here, you can probably get a sense of what is going on here. So looking at it from one side, you know, we could have a blockage in the interventricular foramen or in the cerebral aqueduct. We really don't know because from this image, we can only see that one ventricle is dilated. Looking at our horizontal or axial section, you can see that both of our ventricles are dilated. So this must mean that there's a blockage somewhere in that cerebral aqueduct. And this condition is known as hydrocephalus. And it's just basically an accumulation of fluid within the ventricular system. So what that does is it expands and it dilates our ventricles. So this increase in intracranial pressure is going to cause our cerebral cortex to be basically squished against our skull. And this can produce all these sorts of symptoms, such as, difficulties concentrating, affecting our memory and thinking skills. And that's because there's so many functional areas that are going to be affected by having our cerebral cortex just completely compressed against the outer skull. So again, this is hydrocephalus. It's caused by an increased accumulation of cerebral spinal fluid. And in this case, there's probably a blockage in that cerebral aqueduct area, and it causes an increase in intracranial pressure and compresses the brain tissue against the skull. So for reference, this is that normal ventricle, this is that septum pellucidum. This is a hydrocephalus ventricle. Now, this isn't an adult patient. Let's take a look at what happens in an infant whose cranial vault isn't fully sealed yet. So hydrocephalus in infants is very characteristic. It almost looks very extraterrestrial and alien-like because the sutures on their skull haven't fully sealed yet. So you have an increase in intracranial pressure. It's not as serious because the skull can actually expand. However, if this is not corrected over time, they will be left with permanent damage looking like this. So now with all of that being covered, let's take a look at some practice problems. In this question, we have identify structure A and identify structure B. So structure A is pointing right here. Structure B is pointing to this little opening right here. If you guys want, pause it, try it for yourselves. I'm going to answer it in 3, 2, 1. Here we go. So this structure right here, if you remember, right here, this is going to be that corpus callosum. Just below that corpus callosum, we're going to have that window or that opening into our lateral ventricle. So this isn't the lateral ventricle. This is actually that septum pellucidum. And you can see just how thin it is. And this is going to be connecting our two lateral ventricles. Now this space down here, right below this fornix structure, right here, this is going to be transporting fluid from the lateral ventricle into this space right here. And if you remember what connects the lateral ventricle to the third ventricle, well, this is going to be that interventricular foramen. And the interventricular foramen is going to be found just posterior to this structure right here. If you remember this from our second lesson on the diencephalon, this is going to be that anterior commissure. So just posterior to the anterior commissure, we're going to have that interventricular foramen. Great, so now that we got that one done, let's take a look at our next practice question. And in this question, similar question, identify structure A and identify structure B. So again, pause it, practice it. I'm going to go for it. Right here, this is that lateral ventricle. Here is going to be our frontal lobe. Here is going to be our parietal lobe. Back here, we have that occipital lobe. And then down here, we have our temporal lobe. If you remember which part of the lateral ventricle extends into the frontal lobe, well, this is going to be that anterior horn or the frontal horn of the lateral ventricle. And likewise, if you remember what expands into the occipital lobe, well, this is going to be that posterior horn or the occipital horn of the lateral ventricle. So again, A is that anterior horn, and then B is that posterior horn. So going over the learning outcomes for this lesson, you should now be able to name and identify the components of the ventricular system, as well as describe the flow of CNS through the ventricular system and what happens if we have certain blockages in certain parts. So with that said, I want to thank you for tuning in, and I'll see you in the next one.